with all the news and events of the recent days, we wanted to think a little bit about our contribution to what leaders are going through and the kinds of decisions that those of us who are responsible for organizations are having to make in times of crisis. So Mike and I had been talking for some time about our common experience in leadership situations in different industries, but also our common background in the military, and just wanted to offer some insights from our experience and have just an open-ended conversation about how we can make good decisions and come out of this crisis with our organizations and ourselves stronger as leaders. So by way of introduction, I started this career in a pretty unconventional way. I was a student of history. Then I went and fired Patriot missiles in the Army for 4 years during the 9/11 era and in Operation Iraqi Freedom. And then after that, leaving as a captain, I started my financial career on Wall Street during the great financial crisis, and now am helping to guide my firm and my clients through what is a unique experience in all of our lives. So what we want to try and do is bring some knowledge and perspective, but also some ideas on how leaders can be more effective during times of crisis. So my guest, Dr. Michael Consuelos, his bio is very interesting, having come to his profession from some pretty unique places as well. So Mike is the founder and principal at MJC Solutions, which is a veteran-owned small business that provides consulting and advisory services to organizations large and small, particularly in the healthcare sector. He's had several leadership roles in emergency preparedness and pandemic response since 1997. Most recently, Mike was the Senior Vice President for Clinical Integration at the Hospital and Health System Association of Pennsylvania, otherwise known as HAP. At HAP, he provided clinical administrative leadership for the hospital preparedness program for the state of Pennsylvania. His experience includes leading a health system pandemic response to the 2009 H1N1 pandemic. Mike's coordination of the health system response with local, state, and federal authorities to maintain healthcare business continuity has been used as a model by other healthcare systems. He's been invited to speak to national audiences on regional healthcare response capabilities during nuclear incidents and maintaining business continuity during a pandemic. He has an undergraduate degree from Princeton, his medical degree from the University of Pennsylvania, completed pediatric training at Children's Hospital Philadelphia and the Walter Reed Army Medical Center, and he received his executive MBA from Penn State and is a fellow of the American Academy of Pediatrics. Thanks for joining us, Mike. Good to see you.
Good to see you, Dennis. Good morning. And so before we start, I just wanted to we said hi and how are you there earlier, but I really do want to know, how are you with all this up and down in the market and kids, at home all day? How's that all going for you?
Thanks for asking. It's going well, but it's also one of those times for you really have to check in on the self-awareness side, because it's just the going down the black hole of information and decision fatigue is a real thing. So it's definitely stepping back and drawing on past experience and trying to manage the emotional response and the information flow as best as possible. But it's going well. It's going well. How about you? How have things been for you?
It's been busy. I apologize to the viewers, listeners this morning. I'm a little bit of a scratchy throat. So for the past 2 or 3 weeks, as you can imagine, I've been on a lot of conference calls and been actually doing some podcasts with Jenny Blake and all around this topic. And this morning, actually, before this call, I spoke to basically a tech firm looking to do things in this space. So as you know, I rescued my college-age daughter from University of Michigan. Go Blue. So that was a quick turnaround to get her out of there. And then my son, Alec, who you also know, he's working for ESPN in New York City, and he is 100% home. They've been home as a company at the corporate level in New York City for almost 2 weeks. So the whole family is, doing their thing, but doing well. Thanks for asking.
Good. Yeah, it's been, the pace of adjustment to life has been different from anything I've experienced. So there's a lot of, triage that goes on. So we've gone to a kind of a split schedule of handful of people in the office, handful of people out. Also testing the ability to work remotely in recent days, and all of those things are positive. But it's also made the communication challenging, even internally with the family, and trying to keep up. So we'll get into that a little bit. Tell me just one thing. I was reading the bio yesterday. How did this become the path? for you? How did you get to
Yeah.
pandemic response doesn't sound like the top tier when you're in the fifth grade as far as the things you sign
Yeah.
up to do. So how does it get from there to here?
Yeah, that's a great question, and I think I may just raise my hand a few too many times. So, as you mentioned, we both veterans, and so when I was at Walter Reed, they needed somebody, a pediatrician, on a couple of committees around chem bio response. So that was 20 plus years ago, and ever since then, whether it be at Walter Reed, at Fort Knox, Lehigh Valley Health Network, or at the state level, I've always been interested in emergency preparedness and specifically pandemic response. As a pediatrician, the most common diseases we see are infectious diseases. So it seemed like a natural fit. And so that for me, it was an area of interest from a military perspective from the beginning. And then as we started seeing more and more disasters, mass casualties across the United States, it was just, it's something that I feel passionate about to help people go through this. And most recently, my work has been really around business continuity in times of a disaster, specifically pandemics, because as we're seeing now, it has a significant impact not just on business owners, but employees and families. It's one thing that we will probably continue to see.
So catch us up on the current situation. Can you give us some perspective on where we've been, where we are, here on Thursday?
Yeah, Dennis, before I do that, I want to give everybody a little bit of perspective, because I think that early on there was a significant population, not just in this country, but across the world, that were skeptical about what coronavirus would be for us. And there were a lot of inaccurate comparisons to the influenza. So we have to go back really to 2003. Actually, before I start that, I always forget to tell people coronavirus has been around for millennia. Probably it's just a common, it's a very simple virus. It's just basically a piece of proteins and RNA that's kind of wrapped up in a little bit of sort of fat lipid kind of. It's very, very simple. It's been around for a long time. It causes the common cold, and it is something that we test for regularly now for a couple of decades as we do different infectious disease panels when we're looking for influenza or other diseases. So coronavirus, although it's popular now in the lay understanding, the zeitgeist, but it really has been around forever. So our first introduction to something that was not the usual coronavirus was back in 2003, and folks are familiar with the SARS pandemic. And that point, that's the severe acute respiratory syndrome. That's what SARS stands for. And in fact, it's SARS coronavirus was the first one. And what we're seeing now is technically SARS coronavirus 2. So even though we're calling it COVID-19, that's the technical term. And that started also in Asia and really spread across the world, but not nearly as quickly or as easily as we're seeing now with the current coronavirus, the SARS coronavirus 2. And really it lasted about a year. And it had about a 10% fatality rate. People got very, very sick very, very quickly. But for whatever reason, that coronavirus just wasn't spreading as easily. You'd had to have some pretty close contact with people, exchange, basically kiss, or have someone cough on you persistently on top of you, and they got infected. So people got very sick very quickly. The next one was MERS. So that's the Middle East respiratory syndrome. And that started back in 2012. That was also a very short-lived event that came out of Saudi Arabia and moved to the United States through a few cases. Those folks were very sick. So SARS-1 was not, it was a big deal, 10% mortality, but this was even worse. It was almost 35% mortality, Dennis.
Oh.
And people got sick very fast, ended up in the ICUs very quickly. So when you are an organism that infects another organism, you have a couple of different choices. One is to be very mild, and you can be spread very quickly in the population, or unfortunately for the host, you could have an infection that kills the host very quickly, but that limits your spread. And so with a case fatality rate or mortality rate of around 35%, that actually stopped very quickly. So what we're seeing now, so that's just the background. That's why when it was a coronavirus coming out of Asia and we had mortality rates in the 2 or 3%, and we started seeing evidence that the virus could stay alive on surfaces for long periods of time, hours to days, depending on the temperature of the room, ultraviolet light, a bunch of different factors. It could stick around very well, and was spreading so quickly through the Chinese city of Wuhan and the Hubei province. It really was something that people were concerned about from the very beginning. And as you can see now, there are several countries where the mortality rates are quite high. So, probably the most scary event that's happening right now is that Italy had about 460 deaths yesterday, and about 380 deaths the day before, and that's like a 747 jumbo jetliner crashing in your country every day. The average age of that group in Italy is around 80, so it's a much older population. Just some new data was published earlier today that showing that most of those patients had, if you're 80 years old, most likely to have a medical problem. And so it's definitely that information is helpful in understanding why this is so deadly. But I must warn folks, because this is the other thing, is we start to see pictures of people on spring break in Florida and Texas. Right now, the severe disease rate in people under the age of 18 looks like it's about 6%. So not a lot of deaths, but still a lot of hospitalizations and younger people in serious medical conditions. So that's my 3-minute kind of update and also historical lesson. And this is really not the flu. This is, first of all, it's a completely different virus. It lasts a lot longer on surfaces than the influenza and seems to be hitting high-risk groups at a much higher rate than we've seen in the past in anything that's like influenza.
So for leaders, you're always worried about your blind spots. So what are the things that people aren't talking about or should be top of mind that may be a blind spot right now?
Yeah, well, that's a big question. So I think that right now, as I've done my work in business continuity, what we're seeing now is the impact on the workforce, and we can maybe spend some time around that and leading a virtual workforce. So we're talking about leaders, right? So there are companies, obviously, like tech companies, who are used to having small pockets, productive, sort of deliverable-based organizational structure or methods to deliver their work in a asynchronous around the globe with tech, right? A lot of programmers that are offshore. Those companies, this is sort of not exactly business as usual, but is something they've done before. Mm-hmm. I think what we're seeing now is the how do you run a company as a leader in a asynchronous measure potentially, or in areas where you're not seeing your folks day to day, and are you set up for it? Compounded with the issues with schools being closed, daycares closing, colleges, running out to get your college kids, and now you have even if you had a sort of work at home policy within your organization, I'm not sure you mentioned blind spots. People kind of calculated the impact of working at home with your entire family or in 2-income households, both individuals having to sort of share bandwidth, making sure there's enough hardware in the home and those kind of things. So that's the very top level kind of initial blind spot that some organizations are sharing. So I don't know if there's other things around there that you want to chat about, and that's just sort of quick lob across to you.
I know that there's a race to cash and people trying to figure out how to get liquidity and how you can manage through just the cash crunch that this creates with a lack of customers or a restaurant shutting down, things like that. That's one challenge. How do you think people can pivot in the moment? And if you weren't prepared for the personnel side, that suddenly the dispersion out to the home working and all of those things. How do you do that quickly? Do you think? How do you maintain culture, maintain effectiveness to the extent you need to when you have that quick dispersion of people out into?
So I think the organizations who have the highest level of organizational trust, organizational psychological safety, who are set up that their culture is resilient and agile to take these large hits. I think this is going to be pressure testing a lot of leaders and a lot of organizations. And let me go down, as you talk about that, a couple of things came to mind, Dennis, in that organizations who had been flexing their muscles in this space or actually had a business continuity plan already in place, right? So really, one of the lessons from the folks attending this webinar this morning is that if you don't have a business continuity plan for whatever reason, right now you're sort of making it up as you go. But when you're done with this, so there's different phases of emergency preparedness, and right now we're in the mitigation phase. We're going to be in the recovery phase when this kind of blows over. So I know I'm not answering your answer directly, but I'm just the thinking here is that that's also a learning opportunity for folks to know what they're missing. So I mentioned trust and safety. In organizations, we're used to seeing people work at their desk, at their cubicles, coming to meetings. You sort of have this maybe even false sense of security that people are producing their work, right? And now you can't see them. It's harder to get a hold of them. And now you're sort of doing this thing that we're doing today, and we're having to go through that. So I think that's the companies who trust their folks, who've given them responsibility. You and I are familiar with battlefield promotions, right? So, right. So right now, I think there's a lot of folks out there who are getting battlefield promoted to being a manager of themselves, where maybe they had a manager who would be regularly looking upon their work or giving them feedback. Now you need to manage yourself. You're going from a foot soldier private now to kind of like your own little platoon leader. I think that is something that we will find. The other thing I think that I'm concerned about, I've talked to other people about, is let's call them more experienced workforce that maybe hasn't and totally invested and bought into this technology that we're using right now, right? So people who are not into web conferencing or video conferencing have always been pushing back, or don't good use of meeting hygiene is what I call. During these conferences, putting yourself on mute and all those kind of things, they may be struggling. And I think leaders from organizations need to reach out to people and say, how are you doing with this? How can we help you and support them? Whereas there may be other folks in organizations who are flying through this, but the ones who are struggling may be afraid to ask,
Right.
or weakness and those kind of things.
Well, that's an interesting point. I like the whole battlefield promotion idea, because there's a amount of delegation that happens. So we need you to do this. We need each person to step up and maybe take on more responsibility. But we know, and you and I have worked in both organizations, large and small, sometimes there's a disconnect between the mission and the vision of the large organization and what all the individual participants are doing, that they don't quite feel bought in. And at times like this, that's okay. Like, there's a lot of the vision and mission, that becomes over there. It's very much in the day, in the moment. What do we need to do today? So I think for leaders, it's an opportunity to reconnect with those people and say, vision and mission aside, we're going to do what we need to get done today to get through this. Here are the top 3 things that you need to accomplish. And I think that can be an empowering feeling for that newly kind of, even if it's not de facto, but that promotion that you've received. Here are the 3 things that you can accomplish that help this organization get through this period. And that communication from leader down through the channels can be really important at this point, and gain that buy-in that sometimes is missing during normal times.
I couldn't agree with you more. I think that you have to be so much more clear. You and I can see each other. I can't see everybody else that's attending on this webinar. I mean, there might be some people checking their email right now, right? Checking their Facebook post. They may be cooking breakfast. I don't know, be doing other things, and they're kind of listening in on this or driving to their workplace of work. Whereas if this was a business meeting, that still could happen. And people need to kind of move into a mode, and there's some great hints out there about trying to move into a space where you can as a leader make sure your workforce is on task. But that clarity piece that you brought up is really important. You almost have to over communicate. I'm a relatively fast talker, and it's very odd for me to be speaking at this very slow pace. But the feedback I've gotten from people, Dennis, is, as I look at people who do this regularly, is you have to go to like 80% speech speed, because people are,
Right.
It's a little bit harder to follow. They can't see your gesturing and those kind of things. There's a lot of cues you're not getting. The last thing I'll sort of maybe be transparent. You talk about transparency and clarity. I want to be a little bit transparent and clear about something you said a little while ago about checking in with your people. Now, for those of you who made the call from the very beginning and heard my intro, the first thing I asked Dennis was, "How are you? How are you doing? How's your family doing?" Dennis, you did the same thing for me. Okay, guys. Yes, it was a little orchestrated and felt a little odd, but we're trying to model something that should be instituted into your meetings that are now virtual, whereby we're starting to lose that human connection, and it could be weeks, it could be months. And as leaders, we kind of prepped ourselves around that, but we wanted to model it took like, I don't know, 35 a minute and a half or something, 35 seconds, a minute and a half for each one of us to say this. Okay, maybe you can't do that for 50 people around a boardroom, but when the possibility arises, check in with people, because people are going to be stressed.
Yeah.
The other thing I want to add is that a lot of organizations jam their schedules or their agenda so that literally, if you're like 3 minutes behind what the little agenda says, people start freaking out and they're moving along. Take a step back from that. Leave a little bit of space for this kind of human interaction, for the checking in and checking out of a meeting, making sure everybody's on the same sheet of music. Because if you don't leave space for those questions, then what you're doing is you're shutting people down. They're afraid to talk in this larger meeting that they may have a question that is going to affect their work, where in the past they could walk across or maybe tap the person next to them and say, "Hey, no, did you get that? Or what do they mean by that?" They may do one-to-ones, which they can still do. But if you don't leave space for people to have questions, and if you don't pace your meetings in a way that allows for that safety, that psychological safety, for people to feel safe enough to ask a question and go through this, you're going to miss on opportunities, and you'll fly right past people's needs, and you may run into business problems.
Right. And you're exactly, it's a cultural thing. Like you as the leader, if you're sitting in this hierarchical organization, you can't ask a dozen, 50, 100 people all the time how they're doing. But if you set that tone that this is the right thing to do, to ask someone that, how are you doing really? But then also the expectation is, I'm fine isn't a good enough answer in times like this, because there's something we're all feeling, whether it's professional stress or stress in the family with working from home or anything else. So just setting that tone that each one of us can check in with the other, that it's not just, you as the leader, it's everyone can do this. And it's one of the more important things that we can do in this.
Yeah, no, absolutely. And I think that, while we're talking about communication, I think the other thing that we can talk about a little bit about is leaders communicating during these times of crisis, not just internally, but externally. I don't know what your inbox looks like, Dennis, but every morning I'm getting 3 or 4 major retailers who are communicating to me as a customer about what they're doing. I mean, literally, it's, every other hour I'm getting an email that says, our response to COVID-19. Best Buy, just as an example, this morning, I have no affiliation with Best Buy. They just popped into my email in my inbox this morning, and they said, we're closing down stores to limited hours. They're not going to close stores, but keep them open because we need technology like we're doing now. But they're going to limit some hours in some areas. They're going to limit shifts to people. They're going, they basically went step by step, allow only a certain number of people in the stores, exhibit good social distancing. They went through their plan and communicated it. And then they talked about their employees. So depending on the hours that people work, if they can't work because they're taking care of themselves, their family, they're going to continue to pay them. They're going to continue to basically the stream of income. So as a customer, I'm hearing what they're doing for me. It makes me feel like, oh, this company cares about their employees. I don't know what their internal communication has been, right? So maybe that's been going on for a while, but that external communication that includes the plan for the employees and reassuring what we're doing for ourselves as a company is a huge morale booster, I imagine, for the employees for that company. Because I'm sure everyone who works an hourly wage today is concerned about their income, as we mentioned a little bit earlier. And that crisis communication is critical, both internally as leaders to let folks know what you're thinking, and the external customers know what they're thinking, and show what you're doing for your own employees. That is an important piece of social equity you can build with your employees and your customers. And don't be afraid to change it. The other thing I've been talking, one of the reasons my throat is sore is because I'm constantly called into organizations to assess their business continuity, or in healthcare, what they're doing with screening right now. And day to day, that changes. And
Yeah.
so don't be afraid to change your message, right? And it should be something around, if you've been getting these, especially if your kids are in school or in colleges, you've been getting these little updates, and they always sort of end with, as things develop, we will communicate any changes. And that's another step. Don't be afraid that don't let perfect be the enemy of good at this point in time. Be kind of scrappy, and which makes me think about the earlier question
I like
about
that idea.
yeah, being scrappy and being entrepreneurial. This new time is time to flex your entrepreneurial muscles. So if you started a business and you're now well established, think about the things that you did, said, the behaviors exhibited back when you're kind of scrappy and really working hard to communicate and pitch people. You need to return to those roots, because those are the companies, in my opinion, will help retain uh, their employees, that will
Right.
help retain their customers, and at the end are probably learning in real time. Dennis, we're going to keep going back to this. This is a huge. This is not just a generation defining event. Like, we don't have. Hopefully, we'll never have a World War III, but this is basically the World War III of our generation, the current generation, right? So World War II ended. A lot of those folks, unfortunately, have passed away, but this is a completely, and society learned a lot from that. Manufacturing learned a lot about that. Transportation. If we go back and take our history books, the changes in our society and a global economy that happened after that was tremendous. What I'm hoping is people are learning in the moment, but also looking to, in the recovery phase, change the way they do their business forever, because this is the opportunity.
Hmm. Well, one more comment on the communication side, which is you're right that the effectiveness of that really matters, but I think the precision. I don't know who your benchmarks for great communicators in history
Yeah,
are, but if
good
you look at
question.
someone like a Winston Churchill, for example, I mean the amount of ink that he spilled writing and communicating in his life was just volumes and volumes and volumes.
Yeah,
But when it came to communication, he was very, very precise. He thought of each word and did not overexpand. He wanted to make sure it was digestible and direct. And I think that's the challenge for us as leaders, is to not, there's an over communication, there's communicating about the right thing at the right time. And it's okay to step back from the noise and the chaos and say, what is the right thing to communicate about right now? And you're right. Maybe it's the care of our employees. Maybe it's the care of our supply chain. Maybe it's whatever that thing is, be precise and don't feel like you have to expand on all of your thoughts. Just discern the right thought at the right time and communicate it effectively.
yeah, yeah. I agree with all those. So, have you seen companies that, I guess, I mean, I hate to go the opposite direction here, and we didn't talk about this before, but have you seen where it's not been done well? Are there concerns from your perspective and your work and your profession where you're concerned that people may have missed what we're just talking about?
I think so. Living in the financial world, I think
Yeah.
that the gravity is always towards being very wonky and fundamental, like
Mm.
looking at individual companies and trying to figure out what is the fundamental story that underlies this. And full humility comes about at a time like this where there is no fundamental story. This is something that's unprecedented. This is where we can't project out, weeks, let alone months. It's really a lot of once fear takes hold, then you kind of have to scrap the fundamental story a little bit and think about stewardship and shepherding, whether it's your company, your organization, your family. Think about what it's going to take to get there. Certain things you can't accomplish on the fly. Like, for some companies, you can't change your balance sheet overnight, or
Yeah.
you can't change your organizational structure overnight. But what are the things you can do? I think the people that are caught off guard or on their heels are the ones who are only used to navigating that very fundamental factual side. I really embrace the kind of left-brained, right-brained leadership model that you can't, if you're consistently left-brained and wonky and data-oriented, and you
Right.
don't have the
Right.
the right-brained creative side to balance that out, you're going to be in a jam. Or at the very least, you need to have those right-brained people around you to help manage through this, because you're going to require creative solutions. And that's really important at times like this. So whether it's communication or decision making, right and left brain need to be in balance.
Yeah, well, no, I couldn't agree with you more. And I think that there's people in each of our organizations who have strengths in those areas. And I think it's a leader's um, challenge to make sure that they're listening to those people and draw that out, right? I think if you've learned enough what you're saying about your people and you've been close enough that actually leveraging in this time the different talents, the diversity of views and talents within your organization is going to be really important during this pressure testing. And kind of going back to the other thing I'm thinking about right now is you're saying that around our military experience, every time there was some sort of training exercise or we did something, we always had an after action review, right? We had
Yeah.
these AARs, right? And
Right.
so what sparked in my head as you were saying that is, when does a leader sit back and give themselves space to make sure they're doing the things you just described, right? So in the military, that is formatted. It's like you do an operation, you do a hot wash, which basically means you do it in real, almost like, you're done, you do it right away. What did we do well? There's a whole format. What we did well, what we didn't do well, and make some changes because you want to learn in the moment. Because everybody writes a memo 3 days later, you're going to forget what happened, right? So
That's it.
yeah,
That's it. Yeah.
yeah, so I'm just, what sparked in my brain was the thought that you had about this left brain, right brain stuff is my suggestion to folks who lead organizations is to give space to yourself and your organization to do some after action reviews on a regular basis, to check in and say, okay, we said we were going to do this, communication or whatever else, the creative side, are we being creative enough? I guess that's what's jumping to my brain is ask
Right.
yourselves, are we just using our old solutions for this new problem? What have we not thought of? What else could we be doing?
Right. Right. And you're right. As we were talking about today, we broke it down to the things that develop the organization, the things that develop you as individually as a leader. I think the after action review, the AAR, is the muscle building. That's the institutional knowledge that if you can capture that, then suddenly that becomes the muscle that builds up throughout the entire organization. That's where your leaders are going to come from because they were involved in the decision making. They got to
Yeah.
witness decision making. I think that's my great takeaway from the military experience, and especially, I was a lieutenant when September 11th happened and didn't end up deploying overseas for another 18 months. But in that interim time, that time of preparation, the most beneficial thing for me was being able to sit in rooms and watch decision makers that were much more senior than I make decisions, delegate, be informed. And just that observation made me that much more confident when I was in greater responsibility myself. So there's just such an opportunity at times like this to expose your team to decision making, and the after action review is a great way to do that, and building that into the meeting rhythm. Another thing, just on the personal development side. So, are you a writer? Do you journal? Do you write down things? Do you capture it at all personally?
No, I'm horrible at journaling. Oh, yeah. So, although I think I'm investing, a lot of money into the Moleskin, small book company. Yeah, exactly.
Yeah.
There you go. And so my response to not, so I don't do like personal journaling, but I do a lot of journaling of ideas
Yeah.
and after meetings, and that's what I'm doing. So I get, so from a personal perspective, I probably should do that too during these times. And journaling does help. It helps us collect information, and afterwards, that compiling that and looking back at that, I think is very helpful. I think what you're describing. So for personal development, also, I think the writing piece, what I found is sitting down to type out something, or a communication, or in your case, what you're describing as journaling. It allows you can't write as fast as you can think.
Right. Right.
So I think for me at least, it lets my brain slow down a little bit and flow some ideas. And I think there's good neuroscience behind writing down of ideas and accountability around those. Um, yeah, but so I think it might be helpful later. And I have an email file now between people that I'm keeping on my computer, mainly as a journaling perspective. As I think about the recovery phase, if there's learnings I can pluck from there for future work, it would be helpful for my consulting business or for my clients in the future. That's, I guess I didn't think about it as journaling, but I think it is now as you talk about it.
Yeah. And where I've found it, I was using the kind of the Moleskin method, or just jotting down minutes. So
Yeah.
I have this with me and writing things down. It was useful before, but now I'm realizing how important it is. is every once in a while in the course of a meeting or a conversation around the office, I'll have that particular turn of phrase that I say, that's the summary of it. That encapsulates this idea. Because our challenge is if we wanted to regurgitate, the Wall Street Journal every day or the financial markets, the data isn't a problem. There's an abundance of data. It's that one idea that's going to capture it in a concise way so that you can communicate it. And being able to jot that down in the moment is so important. So if you're thinking about how do you translate the strategy that your business is going to take or the steps that need to occur in the near term or long term, being in the habit of writing that down, and when that epiphany hits you, I think can be an effective way to capture it, and then in the future realize that those moments come, that you do have those enlightened moments where you can communicate in a concise way. Just it's a good idea to write them down or have the means of writing it down. One thing, and this is our rookie mistake here. If you do have any questions or comments, you comment in the public section. We're going to be we have a moderated question and answer, and we'll leave some time at the end, of course. But if you have questions for Mike or myself or things that are top of mind or you'd like to hear us cover, feel free to comment in the sections to the right of your screen, and we're happy to answer those as we go along. So just wanted to make that known as well.
Yeah.
So coming back to the larger organization side, communication is one thing, but now everyone's remote and separate. This could be the kind of creative disruption that sometimes happens over a long period of time, happening in a really, really rapid period of time. Talk a little bit about running a virtual or disjointed organization. What are we learning here, or what can we learn about that?
I like that creative destruction piece. This is forced, so sometimes you do it to yourself. Sometimes your competitors do it to you. At this point in time, the virus is doing it to you.
Right.
Yeah. So the structures that should be in place that you should be destroying this is a great, we're talking about meetings so much here. I keep on thinking we're doing too much on that, but this is a creative destruction for your meeting structures, right? So when everyone's in the office and there's a meeting called, everybody goes to this meeting. Because there's so much bandwidth and only so many people can talk, and there's so much important work to do, this may take your meeting structure times how you handle communication before and after to a new level. And the question for leaders is, are you just going to go back to the old way, which is in some organizations, they have very sketchy agendas. They kind of, whatever, they're meandering. But in this current state, you need to be pretty tactical in your communication before and after the follow-up, the collaborative spaces that people have been using in the past. Start to think about, is that working out for you? How that collaborative space is both in physical space, but now in electronic space. So right. I'm a big, as you know, Dennis, I'm a big whiteboard person. So it's driving me crazy not to stand. So I'm writing this little camera in my study upstairs in the farmhouse. We have a farmhouse in addition. So I'm up cooped up, and there's whiteboards in front of me. And I wish I could no, this is the way you do it. Now there is a whiteboard function, I understand, on this platform, but it's those kind of things in meetings that now you have to be able to communicate in a different way. And so the companies who are moving to that and it's okay to fail, right? So if you try something, get some feedback. If in your organization, we tried this during this meeting, we did something different, get some feedback in real time. A lot of these platforms right now have voting options on them. At the end of the meeting, how did that meeting go? We tried this during the meeting. What are people, thumbs up, thumbs down?
Right.
That kind of stuff. The chat function. So the other piece of gold here is that people may not be aware of is in most of these platforms, there's a chat function, and you can actually save the chats. So people may just at this point in time, I don't know if they're saving them, but you could have somebody who is collecting those, especially if you're asking specific questions. You can sort of denote them somehow within the chat function, allow people who may not had time during the 1 hour or whatever meeting to put in something that is valuable. And you can put in links, you can put in whatever, you can write out to-dos and share it. The chat function is also helpful. I don't know if that's what you're kind of driving at, but this is an example of a very structured organizational corporate thing that everybody does. Meet. Let's start, and now you have to meet differently.
Right. What do you see on when it comes to, I think what we're finding out in finance in particular is that fast pace can sometimes break things. Like we can all
Yeah,
meander along at a reasonable pace.
yeah,
How do you, with a history of planning for pandemic response or things that can literally go viral,
yeah,
how do you manage pace of what's happening outside, but also regulate pace inside? And I use the example of sometimes when you're dealing with finances, the right thing to do is absolutely nothing, like stand pat, hold your ground. But then
yeah,
there's but so the external pace, internal pace. How do you regulate that? How do you manage that as a leader?
yeah. That's great. Uh, so during emergency preparedness activation in the what we call it incident command structure, everybody has a role. So that I think that's helpful is to everybody's clear on their role. So as things are very turbulent on the outside, if there is a PR issue, then the public relations officer and that team. So having structure and following that structure. There's a lot of organizations who have a very loosey goosey kind of structure, which is fine most days, but now there may be need for at least for some tasks for there to make sure there's clear lines to help with the pace. Because if everybody's trying to address the same problem because it's the most important problem of the day, it comes down to delegation. There's so much going on right now that delegating and having people's roles a little more clearly defined, so that that can get done at the right pace. The other piece, when you said pace, it makes me think is cadence,
Mm,
and to try to have a regular cadence during this time of irregular news, irregular issues, things are closing. Uh, so in emergency preparedness, we usually go to a twice a day meeting, beginning of the business day and then at the end of the business day, so that we know for the next 12 hours what needs to happen, what didn't happen, keep everybody updated. No matter what is happening, that piece of regular communication, hell or high water, happens. I mean, literally, aliens and zombies would have to be at the doorsteps for you not to have your 7 a.m., 7 p.m. cadence of your incident command report out.
right.
That's like a rudder, that's a stability piece that's happening in these rough seas. And it lets you know that at least during these times, people need to get their stuff together. There's the specific organizational structure that needs to happen. And no matter what's happening on the outside, this cadence is important. Uh, we're social animals. We like to be together. We're separate. We like to communicate in certain ways, and that cadence of communication, knowing that there's a regular meeting time, a regular transfer of information. If the company is doing daily updates, keep those up. Those are important. People are instinctively waiting for those daily updates on what's happening. That does help with the pace on the outside. I don't know what else. What do you think, Dennis? I'm doing a lot of talking here. I'd
No,
like to have your
the
ideas.
no the pace thing I think is important because we in our business there's a ticker symbol on everything. That if
Yeah,
you wanted to know what something is worth, if you want to know what's happening with economic data, for the most part you can find it out instantaneously. So it's a real challenge to slow that down and not respond to every ticking piece of data. But that's not every business. A lot of times our mind can do one of two things. We can either assume everything is volatile and bouncing around like crazy, which is probably happening right now, or
yeah,
we can assume stasis and everything's staying the same when the reality is very different. So I think part of the leader's job, if there's not a ticker symbol on your business, is to really own the pace and decide that comes back to those kind of critical three things each day. If you can set the critical three things each day, then it kind of acts as a speed bump from your mind racing ahead to some pretty illogical conclusions. And from your employees' perspective, if they're worried about, an existential threat to the business, if they're worried about an existential threat to their career or anything else, keeping things back to what can we do today? What are these three
yep,
things? Kind of removes some of the risk that the pace of thinking, the pace of activity goes so fast that it starts to break the systems and
yeah.
it starts to pull them apart. Um, just in general, what do you pull forward from the military experience into today? Are there habits? Are there best practices? Are there things that you think, yeah, this goes back to that experience and now applies in the civilian world where I am now?
Yeah. So, Dennis, we all had battle buddies, right?
Hmm.
So you always took care of your buddy. We always, the lowest level of organization in the army, at least, was not one, it was two. And I think that I don't want to, I don't want folks that are on this call do not underestimate the impact of social isolation on your workforce.
Yes.
There is great data out there around the worsening of behavioral health problems, of addiction problems, anxiety, those kind of things, but also of health problems that actually there's data. The ARP did a study a while back that seniors who are socially isolated cost the healthcare system $134 more than their age matched, chronic disease matched individuals. So there was more health problems to those folks who are socially isolated, and a lot of that had to do with behavioral health, mental health issues. Do not underestimate, no matter what size your company is, what's happening in people's lives. They're concerned about their own safety, the safety of their family, their income. We don't, we don't want to go into panic mode here, but do those folks have battle buddies? Do they have somebody who they can reach out to? Is there a conversation on a regular basis to make sure people's behavioral health, mental health issues, and you may have an EAP program within your company, no matter what size it is. I think it's a great time to make sure that program is available to folks, that they understand how it works. That it's not, the stigma of behavioral health, mental health is huge. We need to chop that down. And on the lighter side, organizations, it's springtime. I don't know if that people usually had picnics or family gatherings, those kind of things, those kind of get-togethers. I know Dennis, Morton Brown was going to do, I think, tomorrow was going to do
Yeah, yeah, it was
yeah,
our March Madness event, but
yeah,
that's
happy hour.
yep,
Right. I mean,
yeah. So
so this sounds kind of really silly, ladies and gentlemen, but I'm actually going to be hosting, a happy hour for some friends and family via, Zoom at some point in time. I do like an extended family meeting on Zoom every other night, because there's social isolation issues, and I'm just the half an hour call. What is your company doing to maintain a little bit of silliness, serendipity, and happiness, right, in this time of just extreme emotional strain and economic strain, and the immense, what's the word, just ups and down roller coaster in the market? If you're in the financial business, or if you're looking at your retirement, what is the outlet? And I guess the outlet could be downloading something, streaming Netflix 24/7 or whatever else like that, but that's very isolating. So
right, right.
be a little creative. I mean, and in fact, so Dennis can share my contact information. I'd love to talk to folks about what they're doing, and share what you're doing. So we're a small, most of the folks on the phone, I'm sure, are in the Lehigh Valley area. And Dennis, if they have partners they've collaborated with for business reasons, share those ideas. Hey, what are you doing in your area to do this? What kind of interesting things are you doing for that? There can be such a sort of living at not even at the tree level.
Right,
Leaders like to live at the forest level, right? I
right,
think leaders are at the grass tops right now.
right. Yeah, yeah. I think that, I mean, the irony of this whole situation, the sad irony is we are all going through it together, yet we're not all going through it together.
Absolutely. Oh,
That's the real challenge.
yeah. So which is a great point. So I would say we're not doing it together, but we're doing it together with our families, or hopefully
Right.
loved ones.
Yeah.
It's weird. So what sparked my brain right there was World War II. Families were broken up and people had to go to war, right?
Right.
And now it's actually the war is like coming to your household, and you're trying to manage your business, you're trying to manage your family, your kids, if you have kids, and so the battlefield is like in your home.
Right.
Uh, and you said you're right. That is low, and we talk about social isolation. At the same time, it's also like on top of you. It's literally the battlefield is the moment you step outside the door.
Right. And there's we do have a question here I want to pull up because
Oh,
it's
great. Yeah.
related to this. So the question is, Do you think this is going to escalate the idea of employees working from their home? Or do you think people working remotely will realize they don't really like it and long to be back into the office community experience? This kind of speaks to, we talked about what's happening now, but then also what happens on the other side, because there will be an other
Yeah.
side to this. And my personal belief is that the common experience and the common bond is going to draw people back together afterwards, that we're going to see kind of a
Yeah.
snapback of community culture. And it may be, we've talked for many years about, with the abundance of social media, the downside to that has been being present without actually having to be present.
Mm.
That you can sit
Yeah.
there and be in a room and be texting with the people who are sitting to the right and left of you without ever actually having to engage.
Yeah.
My feeling is that there's going to be at least some snapback in engagement and a desire for face to face when that becomes safe again. What I think it will do from a business owner perspective is that we have to acknowledge that this is a possibility.
Yeah.
That this extreme example has to be part of the business plan, but we almost, my partner Katie and I joke sometimes about the aggressive balance of life, that it's never kind of a delicate
Mm.
balance here.
Yeah.
Oftentimes it's aggressive one way and aggressive the other. And I think we will see this snap back to aggressively socializing into the summer months here in the States, but then businesses planning for that aggressive contingency on the other side, where when we need to, we can
Yeah.
isolate and succeed. What do you think, Mike?
I don't know. So yeah, I don't know. I think where I was a couple days ago was I was sort of shorting the office space market in my brain, like, oh, people are never going to come back to work. And then my head snapping back, going, well, maybe what this question brings to mind is there going to be a greater sense and need immediately afterwards for people to reconnect? And I think that is also true. I think being intentional about this conversation as a business owner going forward, and thinking at what the positive and negative of both sides of the story. And the positive side is going to be that if you need to move for whatever strategic reasons, your organization to more distributed remote workforce, then this is a way for you to exercise that muscle. And I'll use recruitment as a reason behind that. We live in the Lehigh Valley. We don't live in the Silicon Valley. And I'm just making this story up in my head right now. So just to think, I imagine there's probably organizations who've had some great talent, let's say in the tech space, and they're struggling getting someone from, let's say, the Silicon Valley, one of the large metro areas, to come to Lehigh Valley to do their work. That's a recruitment issue. So what sparked in my mind, Dennis, with that is, wow, this may be, on the good side, a way of saying, maybe I will hire that person who lives remotely, because now my organization knows how to manage people remotely more easily.
Interesting.
Right?
Interesting. Yeah.
Vice versa. I think that there is also the individual employees who've always talked about, oh, I really want to work from home. Right? I mean, there's always this like magical, like, oh, if only I could work from home, I could work in my pajamas all day. The flip side of that is, I think they're exploring what that really means, and how productive they are. And you may actually have some more mature conversations within your organization, your employees, around this topic.
Right.
And more informed. And I really don't know. I think that is a great question. And if I was a business leader, that's something I would put on my kind of whiteboard behind my desk and continuously look at and continuously ask myself. And then when you're in the recovery phase, rethink that question and get your employees involved in that question. So I don't know. I think we have another question on here.
Yeah, this one, you want to read this one, Mike? Because I think this might be something with your clinical background.
Yeah. So can you suggest how we can appropriately refer clients if we learn they are isolated and may need support services? So yes. So I'll put my clinical hat on, I'll put my pediatrician hat on, and I'll put my public health hat on. So there's a couple of, I think maintaining people's privacy is obviously important in this situation. I think if they're coming to you and they're asking for help, or there's clearly that's in the conversation, then I think it's great to approach them and for them to start off by, and it sounds kind of silly, but just connect with their physician. If they are in crisis, if the thought process is someone is having significant issues, they're a crisis, there are hotlines. Now there's, and I don't have, maybe we may distribute this to the
Sure. Yeah,
attendees.
we can get that out later.
There's actually some texting. It's not coming to my brain right now. I have to look it up. There's actually some, there's a group that does this, I think basically for free, and you text into this number and you get a licensed behavioral health person, and they will just ask you through text anonymously how are you doing and that kind of stuff, and they'll look for resources. There is not enough behavioral health specialists now, or especially after all of this. So I think that there's, in fact, some of my, this, Dennis, some of my passion in working right now is around behavioral health. And I'm actually working with a tech company out of Philadelphia who works with both payers and providers, so on the insurance side and on the hospital side, to do remote patient engagement around behavioral health and do evidence-based metrics so that you can actually track people's things such as how long you're sleeping, how happy, so the mood swings, and they give you some real evidence-based tools. There are a ton of, I hate to say this, but there's a ton of apps out there around this same sort of thing.
Right.
And so for the person who asked this question is that if folks are feeling isolated, some of the things that we talked about today about connecting with your family using just like very practical things, getting away from texting, and actually using the telephone that has this other function where you can talk to people on it. Remember that when we used to have that? So, pick up the telephone. And then I would say personally, if the person who sent this, if you think you have somebody who's doing that, just check in on them. You start off with that and say, hey, the conversation we had the other day seemed like you were a little concerned or whatever. Just keep on and just doing that. Again, trying to protect the person's privacy, and being, so my other part of my business is executive coaching. So one of the executive coaching sort of mantras is always be curious about the other person, right? The coaching is not about yourself, it's about the other person, and be curious about what they're thinking. So the other suggestion is, as you're having these conversations, just be curious. Be curious about how they're dealing with the isolation, what things they're doing. You don't necessarily need to always give them solutions. Just giving them space to talk it out and having a conversation with you could be enough for them to take the next step, or that's all they really need. So without getting clinical, that's where I'm going to take that question.
Great. That's great. I think that also dovetails into just the idea of self-care for anyone in a leadership role, that idea of putting on your oxygen mask first and making sure, one of the sentiments that we've heard a little bit in conversations, talking to business owners, talking to friends, talking to clients, is that in some respects, there's a sense of regret that why didn't I do more? Why didn't I see this coming? And step one is forgive yourself. Give yourself a break, that this is something that's extraordinary. It's unprecedented. It's not something, there was never an amount of preparedness that would have gotten you here. So remove that guilt, to get as far away from that guilt as possible, and start focusing on taking care of yourself and doing that. Because one of the pitfalls for leadership is you become that indispensable person. You just dive in, you take all the responsibility, you take all the blame, all the credit, and you just, a friend of mine has this visual where he talks about it's putting on that rucksack every day. You just put one more weight on it, throw it on your back and go. That's not going to get you there. And that's one of the pitfalls for your own health at a time like this.
No, absolutely. So absolutely. And there is tons of literature both on the business side and the psychology side around sacrifice syndrome. It's notably called sacrifice syndrome for leaders, that they sacrifice themselves for the good of the company. They sacrifice their family life. They sacrifice their health. And this is a well-known syndrome that it probably is going to get worse, that you'll go through a self-sacrifice because you are trying to keep the whole company together in this very tumultuous time, and the weight of the world is on your shoulders. And absolutely healthy habits, trying to resist the moving into isolation. Go ahead and talk to people. This might be a great time to start a community within, for the folks who are on the phone, right, or on the line here, to build a community of people who want to talk about this. This is very sort of one way, us kind of opining away. but is there some energy around, for example, folks right now or in some other parts of the business sector to get together on a regular basis for leaders who would have traditionally maybe gone out and played around a golf or had a cup of coffee or whatever else, exchanged ideas, try to figure out how to resist that isolation and put together some sort of mastermind group or something, right? Some sort of sense of community. So I mentioned Jenny Blake earlier. So I belong to a private sort of community of solopreneurs, and with Jenny Blake, who did a lot of coaching, executive coaching at Google, and is a keynote speaker and does a lot of great work. And that's been, to me, that's been really helpful because I'm on the phone with you, Dennis, or other folks or other clients all the time, but I'm by myself. And this affords me a time to have a sense of community and exchange questions and answers. And it gives us each other every other week some space to just take a deep breath,
Right.
just relax your facial muscles for a moment. Relax your shoulders, take a deep breath, and just care and just spend some mind time about with people who are like-minded around. In my case, being an entrepreneur in this space of consulting, freelancing, executive coaching, and just being supportive for each other. So that's another thing that folks could do if you don't have it already. See how you can do it. And also do with them, but also have compassion for yourself. I think people are going to make mistakes. Everybody on the line right now, including you and me, or we're going to make some mistakes over the next couple of weeks during this
Yes.
unknown times, and just be compassionate for yourself and allow yourself to make those mistakes and learn from them and go forward. Because if we ruminate over that, that is going to be additive, if not multiplying, the stress we're feeling every day.
And what we're doing right now is an offshoot of that. You and I have talked for some time about just that informal mastermind group, the people we touch base with, the people we share ideas with, who are kind of going through some of the same things. So I think it's been beneficial for me, and this is a catalyst for me to formalize that and do a little bit more of having those conversations. So really, Mike, this has been kind of wide ranging on both individual growth. I think we kind of migrated from the organizational to the individual. Any final thoughts on just how you see, let's take this out to the light at the end of the tunnel, how you see us coming out of this, and just things that leaders should be conscious of as we make it to the other side?
Yeah, I do a lot of thinking around that. And I think I've said it before. I think that there are going to be a lot of opportunities for business leaders to learn about themselves. So we kept on, for the folks on the phone who are bored of the continuously military kind of analogies, but we're going to battle, and people who go through battle together make bonds. And there's all the negative sort of post-traumatic stress stuff. I'm not going to talk about that, but they make lifelong bonds. It changes the way they think and manage in the future.
Mhm.
And there needs to be some embracing of that. There needs to be some embracing that what you're doing now, the bonds you have may be stronger in certain areas than you would have thought. That going forward, learning from this, and and spend the time at the recovery phase being intentional about looking at what went right, what went wrong with your organization, and put things in writing. And time to pull the visions and values maybe off the wall and maybe relook at your strategy. I mean, I think everybody's strategic plan just literally got burned, got torched, right? So I'm sure there's going to be the strategic consulting business is probably going to go through the roof after this all said and done. They're getting hammered now, right? Because no one can go
Right, right, right.
think about that. No one's going to be doing any strategic planning, but going forward, people may. I mean, look, it's gonna, all bad things end at some point in time. So that window of time, that crack in time to allow yourself and be intentional to relook at those structures is a huge opportunity, because you and your
Yes.
employees, and also we didn't talk about governance, and we could do a whole thing on governance, right? So if there's business owners who have a board, this may be a time where you can really engage your board in a
Mhm.
completely different way. And at the end, that's also a piece of work, is how how did the board help you, or your advisory, whatever structure you have to give you advice, or if you have a board structure, this is an excellent time to look at forward into what we could be doing. So turn it
Yeah.
back to you.
And actually, we have a question somewhat related to that, and I want to make sure I understand this properly. So, from your backgrounds, would you address lessons learned in the context of planning and future impact of their organization? So, I think, Mike, that's kind of what you're touching on, is that there is an opportunity to capture lessons learned. I know,
Yeah.
it hindsight, I wish I'd written down more of the things that I've been able to navigate in my career, or some of the challenges and pivots that I've made. I wish I had documented that more and could reference it better. Fortunately, I've held on to enough up here to kind of capture those lessons. But I would say that the more you can document, this is where the institutional knowledge is built. This is where your team, like you said, you've gone through the wars together. You've kind of navigated this crisis. There's so much institutional knowledge to be gained, and the team that you were at the beginning is going to be different from the team that you are at the end. Capturing that and understanding, what do we have at our disposal now is going to be really important. We call it around here, we call it the asset inventory. Just stepping back at the end and saying, coming out of this particular crisis where we've, learned certain things, we've developed certain things, and we've made certain mistakes. What are the assets we have at our disposal now in terms of people and process and lessons that we can now make part of an optimistic future for the organization? I think taking time to do that asset inventory is just would be critical. I wish I'd done it more until now. I want to make sure that I do it as we go through and then coming out of this.
Yeah, lessons learned. Yeah, I think we talked about this already. Planning the future. I think that So I mean, just and I apologize for the dog barking, but this is the one beauties about working from home. We're all going to be
Yeah,
hearing
exactly.
kids crying and dogs barking in the background. So we're all real people. So we learned. So 2017, we had Hurricane Harvey. We had the shooting in Las Vegas. We had several other hurricanes, right? So we learned a lot in emergency preparedness, and what we're in through right now, what's happening right now, reminds me we didn't learn enough or weren't intentional enough as you're describing. And so let me explain that a little bit further. The supply chain for N95 masks, ventilators, and all the things that right now you're hearing in the news, um, if we would have looked at the hurricane that hit Hurricane, I guess, Maria, that hit Puerto Rico in healthcare,
Mhm.
a lot of pharmaceutical companies have huge manufacturing plants in Puerto Rico that went down, and we were short. We had significant shortages, things as simple as IV fluids that help us, hydrate people, but also help carry medicines into your body through your vein. Got hammered in that.
Wow.
And we had national shortages. People were doing all kinds of crazy things in order to deliver medications appropriately. I mean, not crazy things in is things that hadn't been done before. I'm not saying they were not safe, but they were going through a lot of hoops that added multiple layers of steps and processes to do the right thing. All could have been avoided if we would have understood the impact of putting that kind of plant on an island that can get hit by a hurricane, right?
Right.
Same problem now. We should have said, if something else, if we saw SARS, hit back in 2003, 2004 in China, someone should have thought, hey, if China goes down, what's going to happen to these medical supplies and everything else like that? That's what we're seeing now, right? So, um, it, that's those examples where it went wrong. On the other side, there's been some things in emergency preparedness that are happening now with these drive-through screening centers. So many of you on the phone may go to the drive-through that Lehigh Valley Health Network does for the influenza. Myself and Terry Berger, who's an infection prevention leader so we sort of saw a model that was in Louisville that year, but the year before that was happening, it was like, oh, we should do this, and we just operationalized it. We made mistakes every year. We did a better and better job. And in the height of 2009, 2010, during H1N1 vaccinations, we were delivering 10,000 vaccines in a day, right? Where we first started, we were struggling with just a couple of thousand a day. So that's a case where we did learn, we applied a new creative solution to a problem and moved forward. More of that has to happen. More of that. So what you're learning now and doing You're going to make mistakes, but you need to keep on honing things down and dust off those business continuity plans 2 years from now, 3 years from now, because there'll be another SARS-like event in the future. Um, Maybe
Hmm.
not right away, but we can't just put those things on the shelf and let them collect dust. Those things need to be discussed. So we had one other question. I appreciate everybody who's still on the line here. And Dennis and I already talked. As long as people are interested in hearing us
I
jabber
think
this
that,
morning,
sure.
happy to
I
do that. Do
think,
you want to take the next one or?
yeah, just the question about how does the military critically review past actions? Can it be done in-house or is it facilitated externally? So the Army, while and both of us are Army, so we'll speak to that. We all wear the same color uniform, but it's still a very disparate organization. So my specialty was Patriot missiles, which is a really unique function within the military. It kind of acts as its own animal sometimes. So we would look across at the infantry or medical corps or quartermaster or some of these other elements of the Army, and we operated very differently, but we all had to operate in a coordinated manner. So if we did, the great example was on September 11th was a Tuesday in 2001. That week, on Sunday night of that week, we were starting a week-long emergency deployment readiness exercise. So that Sunday night, we called in a whole battalion of people, a couple thousand soldiers, and started acting like we were deploying overseas for some emergency. And 18 hours later, it became real. So we
Yeah,
were already going through this preparation process for which there was going to be an after action review and a lot of internal conversations about how did we as a battalion, how did we as a brigade respond to this. But once things became real on September 11th, then it became external to our unit. It became, all right, how do we coordinate with the armor units who need to get tanks on the same planes that our Patriot missile launchers need to get on? And how do we
right.
coordinate amongst these external? So in a hierarchical organization like the military, you're often kind of looking up the chain of command to say, how does each one of these units relate to the other units involved? And I think in a small business context, we're doing the same thing. Is we can do the internal review, but then as a leader, you need to then take that information and then look outwards and say, where are the ripple effects within the external community, whether it's our supply chain, whether it's in our strategic partnerships or whatever it might be. So you do the internal review, take that information, and then communicate that outward because you're never going to accomplish it if everyone else doesn't know the lessons that you learned. And I think in that 18 months from the time we were on alert to the time that we then deployed for an actual deployment, that was the part that we really had to focus on, is taking the after action review and making it
Yeah.
externally shared information from internal lessons learned.
Yeah, no, right. So the beauty of the military is we have structure and everybody knows their job, and we have hundreds of years of messing it up sometimes. So to answer the question, as a consultant in this space, of course, it should be done externally, right? Yeah. So, and you should hire me. No, that's a joke. So, on all seriousness, there is plenty of tools out there after action reviews in the military. There's a lot of disaster preparedness kind of work that you can do that. But I think the people in your community may be able to share that. I think I would start internally and be intentional. Um, as a leader, and I think it can be. I think it can be done effectively in house. I think that people need to stretch. And again, I'm all for people learning. So learn how to do this. Look this up. Again, I'm available and helpful to folks here in the community. I'm happy to help you out. But really, I think it can be done internally. One piece of that I want to hit again. I mentioned hot wash earlier. One piece of advice I would say is that literally after an operation, we would, if it was a sandy area, literally you would just like clear out some sand, draw a little picture with little mountains, and put little whatever sticks in the ground. And go, okay, we did this and this and this and this happened, and what happened there? And you did it literally in the moment. In emergency preparedness, we do the same thing after a mass casualty. So literally after the Las Vegas shooting in 2017, within hours as that got cleared up, folks in Sunrise Hospital, literally, as I understand it, sat down and go, okay, whew, all right, let's start collecting all this information. Let's talk right now while it's still fresh in our brains. What happened? What should we be done? What went well? Let's do some celebration, right? There needs to be some gratitude that people got through this and did the best job they could,
Right.
but it's got to be done in the moment. So I would say to the person who asked the question is that as you're doing a review, take the time, give yourself some space that when something really good happens or really bad happens that comes to your attention, give yourself some space and just say, hey, let's talk about this for 10 minutes. Come up with a very short situational awareness kind of, around the horn. Everybody gets 2 seconds, whatever, to bring their thing in. Do something very, very simple, collect that information, and then you can use it. But the closer you do it to the time of the event, the more informative and informed it will be to the process.
And it also comes back to that word that you used earlier, Mike, which is curious. It really enhances the curious muscle of the leader, because you may not know what questions to ask. The faces are going to turn to you looking for guidance, looking for wisdom, but really this is your chance to turn it back on your team and say, what did we learn? And create that open environment. That curiosity is going to be really beneficial because you're catching it at that hot moment.
Yeah, and back to the battlefield promotion piece, this is a great opportunity, and I don't know the person whose organization this is who asked the question, but this is a great, there may be somebody who's kind of skilled in the facilitating this kind of process in your organization or would like to be skilled in this process.
Right. Yeah.
Heck, help them out, give them the resources, say, it sounds like you're really good at doing this, whatever, can you take this? The leader doesn't have to do everything.
That's it.
You don't have to do every single thing, because your brain as the leader needs to be processing. For example, a leader should never facilitate, in my mind, a strategic planning session, right? We need your brain to sit there and help process what's going on in that strategy session. That's why you hire a facilitator. Internally, if you've got people who are talented and interested in doing this kind of work, give them the opportunity to hey, here's a task. We need to do 50-minute, after action review and structure it, whatever, you run it, and give up that control. That can also be very freeing, and also mentally, it gives you as a leader some rest to not always have to be the one to have all the answers.
Awesome. This has been really good. Mike, so to the extent people want to follow up on this, how can they best contact you? How can they reach you?
So my website is mjc.solutions. My email is mjc@mjconsuelos.com. That's just my business stuff. But, obviously, Dennis, they know you. They can, ring me. There's some names I already know that looking at the attendees. If you don't have my information, please feel free to do that. And for me, I said jokingly, this is why I'm doing this. Really, I'm not doing this to drum up business. This is really, good. I think Madeline just put my website on there. Great in the chat area. Again, another good use of chat. You can actually put links in there. So I'm not doing this to drum up business. I'm doing this because I think it's important for the community, our community here in the Lehigh Valley, and the folks who are calling in from other areas to think about this. I hope that this is helpful for them and has spurred some deeper thinking and knowing that there are folks who are all in the same boat, and we're all together in this. So give yourself some compassion, learn from this. Resist, what you can as a leader to have to shoulder the sacrifice syndrome during this time, and feel free to delegate. And I think at the end of the day, this is again a generational defining moment. We don't know what's going to happen. By the time we're off this webinar, there could be all kinds of different things happening across the world, and nobody has all the right answers. But taking an active role. So taking an active role in your future and not just standing by is really important.
Yeah, the story of 2020, I mean, it's health, it's finance, it's business, it's politics, it's all of those things. But I think for those of us in the position of leading organizations, the unifying theme is leadership. And it's an opportunity to test our skills, to develop our skills. So this is our contribution, hopefully, to that dialogue. If we can follow up in any way with you or elaborate on the things we discussed today or be of assistance, please reach out to us. But thank you for joining us today. Mike, thanks for the great conversation.
Thank you.
It's always fun. Glad we finally put this on camera. We've been doing this often enough.
Yeah, these conversations.
Together.
You guys are this is what Dennis and I talk about when we're in our free
Yeah,
time. And
this counts as fun, right?
yeah,
So
exactly.
good.
And last thing, wash your hands. Wash your
And wash your
hands.
hands.
Yeah, exactly. So if you're at the point at your home or your family isn't now going out to buy hand lotion because your hands are so chapped from washing your hands, then you're probably not washing your hands enough. So that's my kind of high, whatever whatever it's called. The goal is
The
you have to
threshold.
use
Yeah.
hand lotion at least a couple times a day to help heal your drying hands. So Dennis, a pleasure, a great use of our morning. Always learn a lot from your perspective. And again, people happy to reach out and to communicate, even if they just want to bounce an idea off. Happy to do that. I think it's important for all of us to be in this together. So
Thanks so
thank you
much,
very much for your
everyone.
time. Yeah,
Great. Stay strong, stay safe, and we'll hopefully catch up with you soon. Take care.
thanks.